The following video is for educational purposes only. Please use this information with discretion. Our intent is to help you become a more informed healthcare consumer. Ortho University presents Dupuytren's disease by Dr. David Eisenhauer. And now it's time to OrthoU.
Hello, I'm Dr. David Eisenhauer. I'm a board-certified and dual fellowship-trained orthopedic surgeon specializing in surgery of the shoulder, elbow, and hand. In this video, we will be discussing Dupuytren's disease, or Dupuytren's contracture, what it is, how to diagnose it, and how to treat it. We will give you some simple home diagnostic tools as well as some simple home treatment remedies, although unfortunately there aren't many for Dupuytren's disease. But maybe this will save you the initial doctor's office visit, at least for the diagnostics. So first of all, what is Dupuytren's disease or Dupuytren's contracture? This is contracture of the digits due to an underlying disease process of formation of fibroblastic tissue. So this tends to stem from Northern European descent. This is generally something that we see in white middle-aged men of Northern European descent. And what this is organization of fibroblastic tissue below the surface of the skin. In its earliest stages, patients will develop pitting and nodularity. It tends to affect the ulnar aspect of the hand, or the small finger aspect of the hand on the front side of the hand. And initially, patients may notice some knots or maybe calluses, they can appear. Sometimes patients will develop pitting, which means some sunken in skin or kind of some drawn in skin here. As the disease process progresses, that tissue will organize itself into linear bands or cords. Again, primarily affecting these two fingers. However, in what's called Dupuytren's diastasis, or a more advanced disease process, this can affect the entire hand. It can affect the feet, which is called Lederho's disease. It can affect the penis in males, which is called Peyronie's disease. But in the hands is what we're going to discuss today. So as the disease progresses, this is typically when I see patients as a hand surgeon, once the fingers start drawing down, and they can draw down significantly to the point where the fingernails are almost even touching the palm. I've seen this in a few patients, and obviously this leads to severe deformity and severe disuse of the hand. As this tissue organizes into a band or a cord, that cord contracts or shortens, kind of like scar tissue, and that's what draws the fingers down. Typically, this is not painful for patients. Very rarely is there any history of trauma. Occasionally, we'll see a post-traumatic Dupuytren's disease, and occasionally we'll see this occur after surgery, particularly after a wrist fracture that was fixed surgically or sometimes even non-surgically. Patients sometimes may get some very mild post-traumatic or post-surgical Dupuytren's. It's typically not anything we have to do anything about other than watch it. And occasionally we do see this in women, and occasionally we see this in dark-skinned individuals, and occasionally I'll see this in patients as young as their mid to late 20s. So some simple self-diagnostic tools that you can use at home. Really, this is a diagnosis of exclusion, meaning this is something that when I see it as a hand surgeon, immediately I know that this is what's going on. So if you have the pitting, the nodularity, certainly if you have the contracture. Now there are other things that can cause contracture, such as trauma or scar tissue. Occasionally severely arthritic joints will kind of be bent down in a contracted posture. But the other telltale signs of Dupuytren's disease, the pitting, the nodularity, and the cords, this is something that typically visually I can make a diagnosis, and now you can help make your own diagnosis. So what are our treatment options for Dupuytren's disease? Like I said, at home, unfortunately, there's not a lot that you can do to self-treat this. This is a disease that may progress relatively rapidly in weeks to months, drawing the fingers down, although that is less likely. This usually is something that progresses very, very slowly. In some patients, it doesn't progress at all. So you can gently stretch those digits. You can massage that cord and massage those knots and pits. Again, this usually is not symptomatic in terms of being painful. It's more symptomatic when it draws the fingers down and it starts precluding daily activities, wearing gloves, normal daily use of the hands. So at home you can stretch the digits. You can try a splint, particularly at nighttime, because we tend to sleep in this position with the hands curled. Sometimes wearing a splint at nighttime can decrease that.
We pause now with 2 minutes left in the video and ask that you open a separate browser screen and go to MoonlightOrtho.com, where you can quickly register for a free patient account and get immediate access to the final portion of this video, including home treatments and remedies, along with any additional treatments that may be prescribed or recommended in office or via telemedicine, including when it may be time to consider surgery. This also gives you full access to the entire OrthoU video library, highlighting all of the most common orthopedic conditions. Once registered on Moonlight Ortho, patients will have an all-inclusive orthopedic telehealth hub at their fingertips and can pay to be seen by a board-certified and fellowship-trained orthopedic surgeon. Moonlight Ortho is the first and only orthopedic-specific telemedicine practice where patients can be seen online by a board-certified orthopedic surgeon. Via telemedicine, patients can receive X-ray, MRI, lab, and physical therapy orders, along with prescription medications, all within 24 to 36 hours from your time of visit. Thank you for watching, and if you enjoyed this video and appreciate the free advice that our surgeons have offered you, please rate and subscribe.